Hi, welcome back to Dr. Stengler's Natural Healing. Today we're talking about insomnia, trouble getting to sleep, trouble falling asleep. Dr. Mark, you see this a lot in your clinic.
Really do. I'm always amazed how many people have problems with sleep. Patients come in, I'd say a third of my patients, all different age ranges, 30 years and up, have problems with sleep. And so we use natural ways to help them so they don't get addicted to sleep medications.
Well, and not just not feeling good in the morning. What else can not having a good night's sleep? What can that do to your health?
Well, a lot. Research has shown that not getting enough sleep obviously can affect your mood. So depression can be a big one, irritability, poor focus on the job or at school can occur. Weak immunity, not enough sleep. When your immune system regenerates, you can get weak immunity. So there's a lot of health-ranging effects from poor sleep. Also, as I think about it, blood pressure problems. Your blood pressure goes up when you don't sleep well, and your blood sugar levels can go up too.
Well, so for people that have trouble falling asleep, what can you do for them? They don't want to take all the medications. We know many people that have taken loads of medications for sleep, and they feel terrible in the morning. They have terrible side effects. What can natural medicine do?
Well, first we want to address their lifestyle. A lot of people obviously are just stressed out. They're not dealing with stress properly. We've got to get an exercise program going. They need to get more sleep, more rest. But beyond a lot of the general things, we use natural things which promote sleep, help the brain to relax at night. As I talk to a lot of patients, they feel like their brain's just racing. They go to sleep, their brain's not turning off. So one of the supplements I use a lot with patients, very safe to use, is called 5-hydroxytryptophan. What it is, it's the amino acid tryptophan in its active form. So you take it as a supplement an hour before bed, 100 to 200 milligrams. It increases the serotonin levels in the brain, which causes the brain to relax, the nervous system to relax, and that can help promote a good night's sleep. Now, if you're on an antidepressant and anti-anxiety medication, check with your doctor first. You may not be able to use it because those medications have a similar effect. But it does work very well. With a lot of patients, especially seniors, we use melatonin, but not just regular melatonin, we use sublingual melatonin. And that's the type that dissolves under your tongue, goes right into your bloodstream, and puts on that sleep center of your brain, activates it so people can fall asleep. Now the capsules can work well for people too, but I really like the sublingual form. Seems to work much better for more people.
So you've got the 5-HTP option, you have the melatonin option. Is there one you do before the other, or how do you decide what you would do first?
Well, patients that have anxiety, we'll use the 5-HTP, the 5-hydroxytryptophan, because, again, it gets their serotonin level up, helps them to relax. If there's really no known cause for it, we'll use the melatonin. Now, in many severe cases, I'll use both. We'll have them take the 5-HTP an hour before bed, melatonin a half an hour before bed, and that 1-2 combination can work very well for a high percentage of people. But we always encourage stress reduction techniques before sleep, too. So whether it be prayer, reading, there's been some very good studies done on classical music. Listening to classical music 30 minutes before bedtime, after about 4 weeks, is comparable to drug medications to help people get to sleep. Of course, much healthier in the long run.
So what would be your first line of defense? First would be their lifestyle changes, and if that didn't work, then would you go to 5-HTP or melatonin, or would you do calcium, magnesium before? I mean, how do you kind of prioritize?
Well, first we just want people to get sleeping better. So really what we do is we get them on the supplements like the 5-HTP and melatonin, help get their sleep going, and then address their lifestyle, because people often need time to change their lifestyle, eating better, getting exercise going. So over time, we kind of turn back and work more on the root causes, again, with the lifestyle. But meanwhile, people just need the sleep to feel better. So we'll get them going on those supplements. And as you mentioned, if they get tight muscles, they're very tense, calcium and magnesium can also be a nice, safe, natural way to help people sleep. Now, some patients I find, if you give them calcium before bedtime, about 500 milligrams, they sleep just beautifully. They don't need sleep medications. There's other patients, they need magnesium before bedtime. I usually, with patients, have them take both calcium and magnesium, about 500 milligrams of calcium, 250 milligrams of magnesium before bedtime, so you get both. For a lot of people, it does help their sleep quite a bit. They're quite surprised. Even more so in the senior population, we find that's true, maybe because they're more deficient in those nutrients.
And do you give them the liquid magnesium, calcium, or how? Does it matter?
It doesn't really matter. If it's a good product, they'll absorb it. There's many different forms. You got powder, you got capsule, you've got tablets, but it just depends on their state of health.
And so do you start with, if you want to do 5-HTP or melatonin, can you get that over the counter?
Yes. I mean, they're very safe, available in health food stores, some pharmacies, so very common.